Hello my friends and supporter, welcome to medical science class. As a student of medical science, I wanted to take clever every branch of science. What kind of things say do that, but that is knowledge, that is this, and that is good, what that is not. As a Muslim, we are lived down and we get example of election last investments in the world. How much special? By the Ya Alif Lam Nama, Yellow Shafi Lama Pillar. Anar Abdul Muhammad Suhail Shafi, Anar Abdul Muhammad Suhail Mafi, Anar Abdul Muhammad Suhail Kafi. Medical science we discussed elaborated at ear, nose, throat. Now, a common disease of ear, nose, throat. Now, somebody say I have migraine problem. Migraine problem. In case of migraine problem, what is the solution? Already say aspirin, the treatment of choice. Now, that's permanent solution. You want to permanent solution migraine. What is the reason of the migraine? Try to understand that. For migraine, there is eye problem, ear, nose, throat related. But if not related, then you selection of acetaminophen, paracetamol, but not cure, aspirin, not continue. Then you select the artery, give the pressure on your brain. That is the reason your migraine problem continue. If you utilize beta blocker, not more than 10 milligram beta blocker, your migraine problem can be correct. Just like magic. For understanding purpose, if you have hemorrhagic stroke or ischemic stroke, in that situation not. But if you have no hemorrhagic stroke, ischemic stroke, then beta blocker is work as a migraine solution. Not permanently take, just when migraine, just when, for example, 1 week 10 milligram or 5 milligram, 10 milligram tablet, half that, then utilize as a migraine solution. Now my friend supporter, with physician consent, now we discuss elaborated about heart, already heart disease, chronic heart disease like heart, diabetes, and chronic disease like other disease. In case of heart, lung, liver, kidney. Now, in case of already subacute intestinal obstruction, already said, by orally or anal, subacute abdominal, subacute intestinal obstruction can correct if necrosis not occur. Okay, fine. Now appendicitis. The treatment of appendicitis, what is the treatment? If appendicitis, what is the reason of appendicitis? Treatment. Somebody say cut the appendix. If you cut the appendix, you go to the laparotomy operation. But appendicitis, P. coli, bacteria or other thing occur. Then treatment of choice. If appendicitis treatment of choice, there is a not give the painkiller. If you get them, not understand. How you treat the appendicitis? If bacterial infection occur by appendicitis, then antibiotic treatment of choice. If P. coli enter into the appendix, then what happens? Bacteria remain. Then by oral route, you go to the appendix, and in appendix you clear the appendix. No need to laparotomy operation, cut the appendicitis. Just like the vein, you go to the heart, and then heart cut, correct that heart arterial block, angioplasty, just like that. In case of appendicitis, you go to the oral route and go to the appendix and clear the appendix. Picolate, all bacteria, give the antibiotic solution. By that policy, appendicitis you can correct without cut the appendix. New surgery, researchable. Now that is surgeon. Okay, understand, better understand. But if appendicitis is necrose, then laparotomy is not treatment of choice. By oral route, you go to the appendicitis. You go to the appendicitis situation, then by oral route to go to the small intestine, large intestine, in cecum remain in appendicitis. In cecum, go to the appendicitis, there is a, now by cecum there is a, you pass suturing that, then cut the appendix. And after cutting the appendix, you go to the oral route, and by vacuum you come in the appendix in pond, in gut region. Then give the suture and cut the appendix and come out through the oral route. If appendix is necrosis occurs, by that policy laparotomy occur. Sometimes laparotomy, but sometimes now there is incision in appendix place. You know that. How you measure that? Navel to iliac crest, middle 2/3 and lateral 1/3 in between, or lateral 1/3, middle 2/3, middle 2/3, lateral 1/3. Yes, in that person appendix point, identify the appendix point, and then you go to the operotomy, laparoscopy or laparotomy. Laparoscopy is treatment of soil. Laparotomy to open the gut, abdomen. Now, by that policy, you can, without laparoscopy operation or laparotomy, you can correct the appendix. Okay, fine. Now, gallbladder, Murphy's sign. By that Murphy's sign, what is the Murphy's sign? There is a sign to the mid-clavicular line, and you see the from the costal margin. In costal margin, you straight a line, and mid-clavicular line meet there. There is a Murphy's sign. By that Murphy's sign, you understand the appendix. Appendicitis, feel pain. If appendicitis occur by bacteria, then antibiotic treatment of solace, viral. If appendicitis occur by stone, gall leaf, gallbladder stone, what happens? By oral route, you go to the smallest, oral route, what happens? Esophagus, then duodenum. In duodenum, ampulla of Batter. By ampulla of Batter, you enter the gallbladder. When you, by cystic duct, you enter the gallbladder, there is a stone present. Now, what is the kidney stone? Crushing the kidney stone, then come out, just like that. Crushing the stone, gallbladder stone, and they break down. By that breakdown, the gallbladder duct, the stone, if break down and just go to the mixture, then the gallstone come out. Other way, you operatively operatively collect the gallstone. Small pieces of small stone or liquid stone by that policy. If stone go to the liquid form by gallbladder, duct of gallbladder, by ampoule of batter go to the stool, ampoule of batter go to the gut to small intestine to large intestine to rectum, and can go to the stool. By that policy, you not cut down the gallbladder. Also no need incision and gallbladder region. That is the new modern science, modern surgery. In modern surgery purpose, less cut, more success. Less cut, more success. That is the modern surgery. Now you know that how the brain transplantation already I described, heart transplantation, kidney, lung. In case of lung transplantation, what happened? In case of lung transplantation, you go to the chest position. No. Yes. Everybody go to the chest position. But if you go to the back side of the lung position, back side you cut the costal cartilage, you easily come out the lung. One lung is enough to survive. That is modern surgery policy. If lung, cut down the lung, you go to the back side position, back incision, and cut the costal cartilage, right lung or left lung, then come out the lung, whole lung. If lung, whole lung is next row, right or left lung. That is the modern surgery. And one lung is enough to survive. One kidney also enough to survive. No need to other. By one lung you can survive patient. By one kidney also survive patient. Don't worry, don't hurry, don't be excited about that. Today we discovered that is researchable. Those surgeons know about that, they are good. Otherwise not good. If any patient die or heart, I am not responsible, my one and only curatorial not responsible for that reason. Now tips, dental caries. You suffer the dental caries. What is the treatment of choice in dental caries? In dental caries, those have dental caries, you can treat by flucloxacillin. Dental caries occurs Streptococci, Staphylococci on generally. You see the dental caries occur by Streptococci. Streptococci chain-like structure, chain-like bacteria in culture media. Staphylococci grape-like structure. See that. Otherwise, you take the sample from dental caries, then in hot bacteria or virus, you see the bacterial sensitive discs, petri discs, which bacteria is sensitive, which antibiotic is choosable, give that antibiotic in case of dental caries. But if Streptococci, Staphylococci occur, then treatment of choice flucloxacillin. By that policy, your dental caries correct. That is the tips. Thank you very much, my friend. Today is enough from medical science. There is a difference between artificial teeth and normal teeth. In normal teeth, difference between in the teeth and normal teeth and artificial teeth, you can know that. That is the document evidence also. Creator is one and only. Creator say that your teeth is special. That is permanent teeth is special. And the difference between permanent teeth and other temporary teeth, you know that. You see the unit of permanent teeth, unit of temporary teeth. Even in that policy. And by that policy, you know that difference between temporary teeth and permanent teeth. There is a different unit of teeth and permanent teeth, unit of temporary teeth, there is a difference. Allah say by Quran verse. What verse? You find out. Teeth. Human teeth, human body and human body, human process. In embryology process, there is a how teeth formation. When baby come, there is a no teeth. How teeth formation? Permanent temporary teeth, then permanent teeth. You know that. By that policy, you know that in teeth policy, you know that by that stone, in there is a difference between temporary teeth and permanent teeth. Allah say by Quran verse 40 century years ago. Human embryology and human teeth, about human teeth. That is the also document is Allah is constant truth. Al Quran is truth. And Al Quran come from one and only creator, ALLAHU. There is no doubt about that. One and only creator, ALLAHU. Allah say by Quran verse human embryology, human in the how creator created human. Without when Adam alayhi salam creator created first human, how did it come? There is a difference how teeth come, body, muscle and teeth. And there is a difference. You found the unit of teeth with other term, temporary teeth. That is the document evidence that the teeth, human teeth and human teeth with permanent and temporary teeth. Difference between human teeth and temporary teeth. That is the document evidence. Creator is one and only. Creator say by Al Quran verse. And the policy how teeth formation of human. And by that policy, Allah is constant truth, Al Quran is truth, Islam is truth religion. And Al Quran come from one and only creator, ALLAHU, there is no doubt about that. Now you go to the myringoplasty. If rupture the tympanic membrane, you cut the ear area, behind the ear area, auricle area, behind the ear area, and temporal bone, mastoid part. But you go to that cut. But you go to the myringoplasty, not cut that, go to the Eustachian tube and correct that by that Eustachian tube. How? You take the supplement meninges, correct the meninges. How correct the meninges? You correct the meninges, different part of the bone, not this area. Okay, fine. Other part of the bone, a bone osteo bone, meninges or other part of the meninges. Then you not cut to the middle ear. You can myringoplasty by the policy of go to the Eustachian tube or acoustic meatus. Okay, fine. By the ear root, not cut to the behind that policy. Still now that is researchable, I say that, by that operation. Okay, fine. And sometime you, that is the myringoplasty, modern myringoplasty, not need to cut the behind the auricle area and suturing. Without suturing, how you correct that, how you correct that meninges or other. They are not. From osteogram or implant from dead patient or other patient, collect and implant that in ear. Those are myringoplasty modern. In case of deviated nasal septum, in deviated nasal septum, you septum disclose. But if septum is disclosed, bone is disclosed, what happens? By that policy, you can bones, a septum cut and break down the nasal bone. Deviated nasal septum. By that, one side is narrow. But if you go to the policy, what is the narrow side? you modern deviated nasal septum, you go to the syringe and syringe area, and those side remain narrowness and bones is carved. You break down that bone, then straight root, then then keep that by metal straight, then bone also remain, and carb area of the nasal part, that is also straight. Bone break down and then remain the bone to remain that bone, not come out the bone. Remain that bone. The policy is bone also remain, but the bone was the not carved the bone or deviated nasal system, deviated. That deviation is correct by that operation, but bone remains in that modern deviated nasal septum operation. But what is that? You deviated nasal system, you in deviated nasal system, DNS, deviated nasal system, bone cut down, septum cut down, break down, also bone cut down, break down, and come through. Understand? But in that policy, deviated nasal septum, bone, which part is bone is carved, septum, bone and septum is carved, correct that. Not come out, come through that, remain there. Thank you very much, my friend. That is also researchable. Thank you very much, my friend. Today's an Afro Medical Science class.